The broadcast is now starting. All attendees are in listen-only mode.
Well, it's just about straight up time to get going, so we're going to do just that. This is Dr. John Brimhall talking. We have Bettina Torres as our guest tonight, who's a BEMER trainer and user. We have Clark Tilley running the mic and things like that, and of course Doug Grant of OHS is sitting in the background. So let me just briefly tell you my experience with that. Those of you who know me know I have about every toy that you could possibly have. I have a PEMF, I have a hyperbaric chamber, I have body lights for body contouring, I have electrodiagnostic units, some of them costing 40 to 45,000. I have 7 different lasers from 4 different companies. And so when a good friend of mine, Kevin Jellerson, told me that, well, you've got to look at this BEMER, I thought, you know, I don't need to look at anything. I mean, what could I possibly need or have that I don't already have in all the tools that I have? But he and I worked together for some time with one of the laser companies, became good friends. And he said, I'm telling you, you've seen nothing like this. And I have to admit, I really had not. And I was just telling Dr. Brett tonight, who had another meeting, he's going to get the recording on this, that it is amazing the differences in the BEMER than anything else I have seen or done. And I love the toys I have. I wouldn't get rid of any of them. Some of them, PEMF actually kept me out of surgery after fracturing my back in a rollover accident here 4.5 years ago. But this absolutely increases the microcirculation. I'll let Bettina tell you exactly how that works better than I. But you need, for yourself, you need to try this out. You need to see it. You need to experience it. And it's easier to sell than a bottle of vitamins. All you have to do is let anybody try it out. I was at teaching a seminar this weekend, and we have some brand new nutrition out that's homeopathic that helps to pull out heavy metals and helps to pull out the toxins like chlorine, fluorine, bromine, different things like that that would have developed through HS. It's very exciting. And yet I would test people and find all the reflexes were off and which areas they were toxic to. I would put them on the BEMER and then go back and test. When I did that, the reflexes were gone. Those of you who understand AK, you can do a tempo tap, and anything you just covered up in the surface would come back. It did not come back. On about 8 out of 9 patients that I would check, the reflexes went away, they were gone. There was actually healing that took place in there where you could not bring them up in any way. So we have found this is really a wonderful complement to our nutrition. If I'm working on somebody that's really difficult, whether it's a migraine or whatever, I'll pull out the toxins with the homeopathic and put them on the BEMER because it increases the circulation into the area and then hauls the toxins off. So with that, I mean, I've been treating patients every day with it and my whole family, and needless to say, I'm excited. That's why we decided to do this. So, Bettina, let me turn the time over to you and you run with it.
Well, thank you. First of all, thank you very much for inviting me, and I really do hope that all the information that people receive tonight is of value to them, for the medical practitioners on the call, as well as all the other countless individuals that are interested in their health and are just looking for better options. So let me introduce myself first. My name is Bettina Torres. I'm an organizational manager for BEMER USA. I'm also the proprietor or owner of Regeneration Point, which is a facility in Spokane, Washington that I opened because I had these really profound experiences with the BEMER technology. It all started in 2006 when I was visiting my family in Germany, and my aunt had this device at home and it introduced me to the BEMER with the words, "This is the best investment I've ever made." And needless to say, a car crash that she barely survived in 1983 had left her with trigeminal neuralgia and migraine headaches for over 20 years. She was suffering, and then she was introduced by a German doctor to this device, and her life, her quality of life changed, it improved, and she managed everything just by using BEMER. This is my lovely aunt. That was in 2012. She came to visit us for the very first time. She's a very vibrant woman. She's 78, and I cannot believe like the rate she's going still. The second story, why I opened up my facility, is this lady's story, and I have to really point this out because it's a really poor quality picture. You're looking at a person with MS and scoliosis, and that's my mother-in-law, and that's her head. You're looking at her from the front. MS has a terrible fatigue involved, and with that, the scoliosis became worse and worse, and she became so curved over that if you saw her walking away from you, basically you couldn't see her head. And fast forward, despite all the predictions from all the doctors she had in her life, we brought her to our home, and I used the BEMER continuously with her. In 1 week's time, I had her climbing stairs with me, and by January, exactly a year later, that was the same person that was able now to exercise, and this is at my facility. I use special exercise equipment there in addition with the BEMER. So needless to say, I'm from my own personal experiences. I suffered from arthritis. I started using the BEMER in 2007, early 2007. So for over 8 years, I do not have to depend on pain medications. I do not get cortisone shots. Neither do I have to have further surgeries. And so I'm really, really thankful that I have this technology in my life. And from the countless experiences that I've now seen at Regeneration Point, I have to tell you, this is probably the most significant health innovation that I will come across in my lifetime, and probably many of you as well. And I'm forever grateful that I'm involved with this really incredible company. So, what is BEMER? Physical vascular therapy, BEMER. Well, the effect is on microcirculation. And microcirculation functioning will reduce our susceptibility to infection. It will strengthen the body's physical defenses, and better blood supply and detoxification of organs and tissues is possible with good microcirculation. It reduces the effects of stress. Supporting impaired healing processes, for sure. You need microcirculation for that. Better performance and capacity to perform. Shorter regeneration recovery periods and a much decreased risk of injury are possible with good microcirculation. So when you look at the influences today in our lives, we're looking at so many people who are still eating horrible foods. Fast foods, it puts an enormous stress on our bodies. They're loaded full of toxins and a lack of real good nutrients, lots of noise levels all around us, environmental pollutants that we just cannot escape, lack of movement. Well, the average American, unfortunately, I have to say, moves about half a mile, and lots of stress. All these factors, overstimulation, will have a detrimental impact on our microcirculatory system. And this means it really is a disturbance, right? Our health will suffer, our well-being, our quality of life suffers, our ability to self-heal suffers. We have a disturbed immune system because of all these stress factors. And we are looking at more frequent and longer sickness, meaning chronic disease. That's just a simple fact. But in medicine, we also know something, that the body can regenerate itself, that aged, sick structures are broken down and replaced with new healthy cell structures, and they're built up again. So we regenerate. That is certainly possible. That enables our body to remain healthy, and we have this inner doctor that keeps our homeostasis intact if the body gets what it needs and if we dispose of all the things that we really don't need. And we all know wounds and broken bones can heal, right? Inflammation can subside, and it all starts right here with the iceberg principle, where I always point out when we look at Western medicine, we really are addressing the human body right up here. We're looking at symptoms, and that is similar or equivalent to the tip of the iceberg. The iceberg is, however, only 7% of an entire iceberg. And here we're looking at the body in terms of chemistry and mechanics and leaving something out of the equation, which is energy. So we need to look something at the bottom here where everything starts, and that is a circulatory disorder. If we do not get oxygen delivered to our cells, it will lead to an energy deficit. And energy is actually a physical molecule. In every single cell it needs to be produced, and that is called ATP, adenosine triphosphate. This little molecule enables our body to achieve homeostasis by producing the correct amounts of proteins. Things can be upregulated, downregulated, but if this is continuously lacking because of oxygen lacking, that means our cells will not perform their task, and eventually it will rise up to the area where we can feel something, where we have symptoms, where we feel pain. Our body is comprised of about 100 to 1 trillion cells, and they all try to do their tasks. And in order to achieve homeostasis, we need to produce about 500 quadrillion proteins per second. Per second, that is. That's not a day. Per second. That allows our body to achieve homeostasis. Additionally, 21 sextillion chemical reactions need to take place per second again. And that's why we require such an enormous amount of energy. This ATP, we need to produce about 90 to 170 pounds per day in order to perform all these tasks. That's an enormous amount of a little molecule, and we don't store it, we use it up right away. And again, adenosine triphosphate, that's what ATP stands for. That's our cellular energy that is produced in every single cell. So BEMER has an impact on microcirculation, and let's look at the site of action first. Our cardiovascular system is comprised of big vessels and small vessels. The big vessels are arteries and veins, and combined they make up 26% of the cardiovascular system. The rest of the system are small vessels. That's considered microcirculation, and that's where BEMER has an impact on 74% of your cardiovascular system. So when your heart beats, it will pump blood into these large vessels. The rest are microvessels, and that will supply these 100 quadrillion cells, and I'm pretty sure I said this wrong right now, but there are enormous amount of cells in our body, and they all need to be fed and cleansed, and this is where we do it. We do it in the capillary beds, and for that we need to have blood flow into the larger arterioles. It pushes the blood into the capillaries. Wastes get picked up, so we deliver here and we pick up here, and then it is moved out through the venules back into the large vessels. So 74% of the vessels are small vessels. And when we look at the disturbed microcirculatory flow, we can clearly see here in this video how clumped together the red blood cells are. And this is a study done with younger individuals, they're 25-year-old athletes. And here we are seeing the improvement within a 2-minute period on the BEMER. These athletes produce a lot of lactic acid, and for that reason also the red blood cells can clump. And an athlete, it's really highly important to be able to regenerate faster, and you can clearly see how this improves and will lead to the removal of lactic acid much faster than without the application of the BEMER. Here, like in the next slide, we're looking at this side by side, and you can clearly see how stacked this all is and how clearly visible it has improved after only 2 minutes on the BEMER. Now, what are we activating specifically in microcirculation with the BEMER? We are activating vasomotion, and that is the rhythmic relaxation and contraction action in these small vessels, pre and post capillary. So this action takes place in arterioles and venules to push the blood into the capillaries and move it out of the capillaries. And this movement should occur about 30 times per 10 minutes. When we have impaired vasomotion, it could be as much or as low as 1 time per 10 minutes. And now when you look at the requirement for every cell in your body of oxygen on a regular basis, it takes just about a few minutes, maybe 4 or 5 minutes, for cellular tissue to suffer and die, because without oxygen, our cells will die and not perform anymore. Rhythmically, this in an animated or in an animation, we're looking at vasomotion, and so it's a rhythmic expansion and contraction of these small vessels. For instance, in a diabetic, we may see this only once per 10 minutes. That's a real problem. And to look at this in real time, in the intestinal area, we can clearly observe the autorhythmic movement in these small vessels. They're narrowed down, and here as well. And with that, pressure differentials are created, and blood flow can move in also different directions. You will notice in a second here how the blood flow moves in a completely different direction. This is also based on a stimulation that these vessels receive directly from cells who basically tell the environment, feed me. So here right now, like the blood flow direction changed because there were probably stimuli coming from these cells that indicated that blood needs to flow here to deliver nutrients and oxygen and pick up wastes. That is how vasomotion works in a nutshell. So when you're healthy, you have a good normal vasomotion, you will have good supply and good drainage. That is necessary for all cells. When you're sick, it is reduced vasomotion, it leads to poor supply and poor drainage. And that is detrimental to any state of health in any tissue of your body. So when we are affecting vasomotion, we have an impact pre-capillary as well as post-capillary, and inadvertently as well as in every tissue area. So the whole body benefits from BEMER applications being exposed through a full body applicator, where the whole body gets exposed to the BEMER signal and gets this benefit that this vasomotion works, and supply and disposal can work again as well. Regeneration of cells is only possible through this function. And here we're looking at a complete obstruction. This is a complete blockage. The BEMER signal is on, so it is penetrating into this area, and we are seeing here that it is being reabsorbed into the bloodstream. And we can also here watch as seconds tick by that clear changes will start to occur in a few seconds also down here at the bottom, where everything has broken down and is starting to move. And this clear obstruction that normally would be irreversible is now being removed and dissolved. And this takes place in about 1 minute and 5 seconds. And there you have a restored blood flow to an area that was completely obstructed and that would have been irreversible. Well, just to show you what I mean with irreversible is a diabetic leg ulcer. This has been in treatment for 3 years. And we clearly see the discoloration of the whole tissue and broken down tissue and necrotic tissue right here in the center. And I said before irreversible. Well, if this stays irreversible for this person, the only option we have is amputation. When this person, after 3 years in treatment, was introduced to the BEMER, this was possible after 1 month and after 2 months. This wound had completely closed, and the discoloration is slowly going away from the tissues. So meaning restored microcirculation means that repair takes place, regeneration can take place. But in addition, disturbed microcirculation, in addition to diabetes and poor wound healing, it can also lead to osteoporosis, cardiovascular problems, heart attack, arthritis, stroke, dementia, migraines, pain, organ impairment, all of the above. And in my experience here at Regeneration Point, I've seen all of those. Let's look at the active substance and the signal and the rhythm, and what makes the BEMER so unique compared to any other pulse electromagnetic device out there. The BEMER signal configuration is an overlay of a multitude of sine waves, and before the signal has reached its highest amplitude, one stimulus component would have experienced 40 peaks and valleys. And that makes the BEMER signal unique. And it is based on a mathematical formula which is patented, and it cannot be, nobody can even come close to this. And so with this 40 stimuli in one BEMER signal, we can use very low frequencies and as well as a very, very low intensity electromagnetic field to have a really powerful impact. And it is this signal configuration, this wave, that the body understands. And the body reacts to that. These small vessels react to this specific signal configuration. And the timeline is as well very important, and the frequency. So now we have two systems in place where we can observe vasomotion. One is a larger calibered portion of arterioles and venules, where we have a smooth muscle contracting rhythmically, and that is superior regulated. Then we have a narrowing down into lighter calibered arterioles and venules, where we see vasomotion based on a nitric oxide gas exchange. And so both these systems do react. When this BEMER signal is delivered at 10 hertz, the larger calibered vessels will react, and at 30 hertz, the smaller calibered vessels will react. And so these two systems have to also be synchronized, and the synchronization of both vessel systems moving is also affected with the use of the BEMER. And by that, we push more blood into the capillary beds and move more blood out of the capillary beds. So what are the parameters of improvement in microcirculation? Here are the statistical value changes that are quantifiable, repeatable, and applied to a large random population. We have well over a million users worldwide, and it is always, as long as you have microcirculation, you will see these statistical value changes possible. The BEMER direct impact is on vasomotion, and that improves by a rate of 27%, which then increase the blood flow into the capillary beds, and that increases by up to 29%. And venous return, meaning we're taking out more of the waste that may have accumulated over months or sometimes even years, will improve by 31%, and oxygen utilization improves by 29%. And that means your body will produce more ATP, it will function better, and the ability to get back into homeostasis is enhanced. We can thank this man that we know about the BEMER what we know today. This is Professor Dr. Rainer Klopp. He is the head of the Institute of Microcirculation in Berlin, Germany. And he is the person who has technology at hand that allows him to observe in real time whether any stimulus has an impact on these small vessels. And this is how we know that the BEMER does stimulate vasomotion. And it was really a coincidence that he came across this device as he had been tasked by the German government in conjunction with the International Geriatric Organization to find something to help the elderly improve their blood flow, because we know aging will slow down anything, including vasomotion. And dealing with the baby boomer generation, also governments are interested in cutting healthcare costs. So he was tasked to look at different options for the improvement of blood flow in this area, and he looked at a variety of modalities, including pulse electromagnetic devices. And whatever was known to him at that time was improving blood flow anywhere between 5 to 10%. And looking at these electromagnetic devices, of which BEMER was one, he noticed that there was some improvement going on, but not really of therapeutic value in his mind. It was improving blood flow anywhere with 5, 6, 7%. And the BEMER, and by the way, also none of these devices improved or stimulated vasomotion. And the BEMER, however, he was able to observe that the smaller color blood vessels, pre and post capillary, started moving again. And the improvement in blood flow was around 15%. So that was even more than what was known to him before. And he contacted the company and asked for more devices to do more studies with them to find whether this is actually something of a fluke or has validity scientifically. And with the improvement of the signal configuration, we today have a much, much improved signal. But also another thing that is very noticeable is the BEMER impact on the immune system. White blood cells need to roll and adhere along the blood vessel wall to detect stimuli. If there is a pathogen in the tissues, which the stimuli will cause them to transmigrate and then engulf the pathogen and then render the pathogen useless and go back into the bloodstream and continue their work. They only will receive the stimuli if they are rolling and adhering along the blood vessel wall. And for that purpose, I want to show you a video where this is very observable. So initially, this is a 4-sequence video. Initially, you will see a very, very stuck blood flow and hardly any perfusion into the capillary. This is from a chronically stressed person. It is taken in the colon. And initially, when you are watching this video, I want you to pay attention to the left side, where we see what happens or how a clot starts forming in the capillary. And that has something to do that a capillary only can hold one blood cell, red blood cell at a time. And here they are so stuck, and when too many squeeze in at the same time, a clot starts forming. That's just the start of it. And then it will just keep on piling up. Now we have turned on the BEMER, and the person is now about a couple of minutes on this device, and we clearly see that the clot is gone, and blood is flowing into the capillary, while this still looks kind of stagnant here and here. That will change also within the next few minutes on the BEMER, and it is clearly visible in this next sequence. In addition, you can now also observe the roll and adhesion behavior of these white blood cells. That is our police. This will keep us from invaders, from pathogens taking over our body, leading to infection. So this is a good roll and adhesion behavior in our white blood cells, and this improvement can lead to dramatic health benefits for anybody to stay healthy. And this is after BEMER. This is within a 2-minute period after the application has stopped, and this is still improved, and this effect lasts 12 to 16 hours. When you look at the effect from before, or the contrast from before and after, and you imagine that in someone's problem area, well, this is certainly very, very poor blood flow, and this is the effect for after an 8-minute application, and it will last 12 to 16 hours. That's quite remarkable. We have 2 sets that make that possible in our body. The BEMER Classic set is 4,290. It comes with the B-Box Classic, the B-Body Classic, and the B-Spot. The B-Body Classic is the full body applicator. The B-Spot is a very localized, targeted round applicator. We have some people that will opt for this device due to sometimes poor eyesight, because they can feel the push buttons here, and also sometimes people that are alone, they don't see the necessity to spend more money, or they don't have to share anything. However, we have the BEMER Pro set, and this device is 5,990. And in contrast to the BEMER Classic, which can only handle 1 applicator at a time, this device can handle any of these 4 applicators, any of the 2 applicators of the 4 applicators at the same time with completely independent settings. The BEMER Pro comes with the B-Body Pro, the B-Spot, and in addition also the B-Pad, which is a rectangular belt-shaped local applicator, and also the B-Light. In this case, we're utilizing an LED red light, and penetrating only into the layers of skin and improving microcirculation here. So it also has, in addition to any skin issues that someone may have, also a wonderful beauty application. And so for a clinical setting, this is certainly a device that most of our doctors opt for, but also families that have it at home where multiple people are in the family and wanting to use it and they don't want to fight over the devices, are opting for the BEMER Pro, as it allows you to run 2 applicators. On the touch screen, we can also clearly see all the local application running. And so there is more functionality with this device. Here we see a beauty application with the BEMER Light. And then we also have a wonderful applicator. It is an accessory that is $590. And it is very ideal for people who are not mobile, who are stuck in wheelchairs. So they can put this behind them. They can sit on it. It obviously has to be attached to the B box, and also people who are sitting at desk jobs, who just do not get enough movement, will see a great benefit from the use of the B sit. The BEMER comes with a 3-year warranty and a lifelong system updates. We have a lot of custom events all throughout the United States, a technical service center to support, and personal close support from all the distributors. And we are in well over 50 countries by now. This is BEMER headquarters in Liechtenstein. The product is manufactured there, and we are now 17 years in business. We are well published in many medical publications, popular publications. We hold 5 patents worldwide, well over a million users worldwide. And it was engineered and invented by Germans and yet put together by mostly Swiss who work at this facility. I want to show you briefly some other cases where you can clearly see the impact a BEMER can have. Here we're looking at acne. During puberty, most kids will get pimples, and some get really a severe situation with full-fledged acne. This is only 14 days into the use of the BEMER, and that can make such an emotional impact for a young person to have healthier looking skin and not being teased anymore. We're looking here at a severe case of psoriasis. All over the backside here, really raw spots all over, and this is only 15 days with the use of the BEMER. Eczema before BEMER, very raw and open, and a day into the BEMER use and a second day into the BEMER use, and we're looking at already much improvement. A diabetic toe ulcer. Here we're looking at a case that was scheduled for amputation, and right here in the center toe has a totally necrotic, complete dead tissue, and we can also see that complete stasis is going on, so cutting off right here would not be feasible to be able to sustain healing in an even greater wound, so the cutting always goes to a place where there's sufficient supply of blood to affect healing. And now we're looking at the foot 8 weeks post-surgery. Yes, the center toe had to be taken, but what a dramatic change from having to take a whole foot to losing only one toe and keeping a foot intact. Diabetes also can have an impact on the eyes, and here we're looking at a situation with inflammation in the retina, and that constitute a big problem for a lot of diabetic people who can also go blind because of this situation. We see a lot of wonderful results. We have a lot of eye doctors who have embraced this technology now, who are seeing wonderful results with these types of situations. This is 2 months and 9 months later, where hardly any inflammation is visible anymore. And one thing about the retina is one of the tissues in our body that has the highest metabolic need. So the rapid fire activity of these cells requires a substantial faster supply as well as disposal to and away from the tissues. And so if you don't have that, you see inflammation, and that is constitute a big problem. Herpes zoster, that's the virus that causes shingles. Here's before BEMER, quite swollen and very painful, can also lead to body-wide neuralgia. After 3 days only with the BEMER, the inflammation, the swelling is down, and also pain will subside in this circumstance. Here we're looking at a fractured femur, and this was a complete break, and it was a 16-year-old who had then to be immobilized after the surgery. So 4 weeks post-surgery, after being immobilized, we do not see calcification right here in this area. Now, another 4 weeks later, with the use of the BEMER, so 8 weeks post-surgery, we are seeing complete calcification, and that means healing has taken place. This person was mountain biking and had a horrific accident, nice face plant, and healing takes place with the BEMER in a really dramatic way when you look at him at only 12 days later. This is a really, really dramatic change. In Europe, we have the BEMER even in use in incubators in some hospital. You can see right here, we're looking at actually the BEMER 3000 Plus. This is the older model from what we have today. Today we have BEMER Pro and BEMER Classic. And now it is such an easy application. It is only twice a day for 8 minutes. However, we also have an integrated night program with our BEMER Pro and Classic. One thing to understand that during the phase of activity, during the day, musculoskeletal tissues, stomach and brain, so the upper digestive tract, has more demand for supply and disposal because of its activities. Now we're going to bed and we go to rest. Now the areas where the body now detoxifies, repairs, and regenerates has a greater demand. And for that to happen, we need to redistribute blood into the areas of the liver, kidneys, intestines, skin, and pancreas. So all of these activity areas need to be supplied more, and that can only take place when you have good sleep. With BEMER, you will enhance the quality of sleep. You will see a much, much more enhanced regeneration phase, and detoxification and deacidification can take place as well with the BEMER Sleep Program. BEMER not only has an impact on humans, animals have microcirculation as well, and this animal for sure is enjoying their BEMER session right on top of their owner. Here you see the owner's feet and the head up there, and this little puppy is enjoying his BEMER session. A quick description of a dog that has Demodectic Mange. This dog was adopted in this stage shortly before being put down, and so the mites take over and kill the follicles, and the hair falls out and creating lots of sores. So when this dog shook, the blood was splattering off the body, and this is only 12 days later. Hair is already growing back, and this little puppy here has a new lease on life. I mentioned already before from the blood flow video that I showed about the study we done with athletes, but whole Olympic teams have embraced BEMER because with BEMER they see faster regeneration, which is highly important in sports. They see faster healing as well, highly important in sports. And so BEMER has become quite a favorite in Europe, and whole soccer teams are using it, and very well-known athletes all over the world. I want to mention a couple of physicians here in the United States that have been known for their specialties. For instance, Dr. Klinghardt, he's a Lyme specialist who has a clinic right here in the state of Washington outside of Seattle. His assessment of the BEMER is that he completely trusts it. It's one of his most valuable tools in his practice as well as personally, and they use it daily, helping people with microcirculatory issues, reducing inflammation, pain, for detoxification, stress release, athletic recovery. But he also sees the value and benefit that a whole family in home use can have. Dr. Bernie Siegel is a well-known oncologist and also assesses the BEMER in a very similar light. He has been using the BEMER for a while, is already pleased with the overall results, more energy, sense of physical and emotional well-being, and he assesses it as well that in cancer treatments and other disease treatments, it could be a very, very helpful tool. And now we will also have BEMER in space in the future. BEMER and NASA have signed a contract, a Space Act agreement, allowing NASA to utilize this technology in space and the future undergarments of spacesuits, as well as pre- and post-flight. Because in space, astronauts experience a real problem with fluid distribution that can lead to a high degree of muscle atrophy and bone loss in a very, very short period of time. And for that purpose, they had been using pulse electromagnetic fields with a very simple square wave. And so now, after they have had evaluated and vetted this technology that we have with BEMER, they opted to utilize that and signed a Space Act agreement with a last-minute sentence added that a new study in space on microcirculation, they want to include this technology. So recap, all your cellular function depends that the exchanges take place. Nutrients and oxygen need to be delivered, and waste products need to be removed for our bodies to achieve homeostasis. It's as simple as that. And that only can occur if we have this rhythmic movement, pre-capillary as well as post-capillary. Vasomotion is here the key. When our heart beats and pumps blood into the large vessels, and that would stop, well, that it would mean the end of us. If this stops here and here, it just is a slow death for our cells. And like I said, every cellular function in your body will depend on that. From mental clarity, our immune system functioning, sex, pain, healing, regeneration, you name it. Everything depends that these exchanges occur. And it can only occur with good vasomotion, and this is exactly where the BEMER shines. It's a singular technology that has an impact here. And while you cannot get younger, you can certainly feel younger. At this point, I want to switch